What if we can help severe autism to get better 1000% faster? From severe autism, you can draw all the circles. To draw whales, dolphin, starfish in the deep blue sea. It looks unbelievable, but how can we do it? I'm Dr. Somrot, a physical medicine and rehabilitation doctor from Thailand. Today, I'm going to show you my experience and my program, Network Transcranial Magnetic Stimulation in Autism, a novel practical protocol. Transcranial magnetic stimulation is a non-invasive neuromodulation using magnetic field-induced neuroelectricity, plasticity, and functional connectivity. It is used in many conditions, such as major depressive disorder. Today's presentation started 9 years ago when I did a double-blind randomized sham control trial in NTMS and CP children on spasticity, but accidentally found a dramatic improvement in speech, even in 10 sessions. So I'm curious that even the CP brains is quite severe, more than other diseases. How about nonverbal autism? If your children have severe nonverbal autism, you will deeply understand her feeling.
คือณตอนนั้นคือเป็นซึมเศร้าเลยค่ะหมอคือเราอ่านอาการเนี่ยคือลูกเราเข้าข่ายออทิสติกเลย
Our pain point is in a severe autistic treatment takes a long time and a huge endeavor. And when they become a teenager, hormonal crisis. Some of them might be diagnosed bipolar or schizophrenia in adulthood later. Family suffers. Society is slower. I have been studying a lot of research about TMS and autism with hope. And in 2018, the meta-analysis showed that TMS is insufficient to treat autism. Why? I regretted for a while. As a scientist, and using 8 brands of TMS machine, I analyzed the meta-analysis deeply. Most studies use single spot stimulation, single frequency, older age, and one-size-fits-all protocol. This TMS model once worked for adult depression, but the childhood autism is totally different. The problem is not single spot. Functional MRI found many underactivation and underconnectivity in many regions. Frontal lobe, broca language area, mesolimbic pathway, reward circuit, corpus callosum, right temporal parietal junction, supratemporal sulcus, cerebellum, amygdala, visual association, somatosensory, and motor networks. From histology, a typical child's brain has a pruning process that helps to erase unused synapses and conserve energy, time, space effectively. But autism has less pruning process, loss of wasted and non-functional synapses. Loss of wasted synapses, oversynapsis, overactivation in the local area, the short-range connectivity. MRI showed abnormal white fiber tracts, especially the long-range connectivity, whole brain. Connectogram show autism had less long-range connectivity, less communication between lobes, and less cognitive function. But increased overcompensated short-range connectivity causes restricted and repetitive behaviors. Modularity is a group of functional neurons working together to perform tasks. It increased from child to adult, increased the brain efficiency and executive function. But autism has less modularity, less executive function. You can see now, autism has the whole brain networks problems since birth. So a single small spot stimulation is insufficient. Next, most of studies used a single frequency. Surface EEG showed that the normal brain uses multiple frequency waves from 0.5 to 100 Hz to communicate between lobes, especially the learning function that require high frequency, beta and gamma waves, 12 to 100 Hz, that are lacking in autism. So stimulation with only one single frequency is too little, too low, and insufficient. Next, the other edge. Most of studies recruit adulthood autism. From birth to age 6, the brain expands 90%, and at age 10, nearly 100% of full size. The white fiber tract forms massively in this phase. This is the golden period for brain connectivity and our brain functions. Many studies call autism a connectivity syndrome. In adulthood, these wrong connectivities are fixed and very difficult to train. So, 20 to 36 years old is quite harder. The younger, the better. Even the same syndrome, but individual pathologies, so one size fits all is insufficient. During 20 years, the world of neuroscience evolved extensively from genetics to connectomics, but the role of treatment has been developing little by little. The meta-analysis confirmed that the old paradigm is insufficient and need to be shifted. So, my colleagues and I have developed the network TMS that stimulates multiple networks, major hubs and rich cloud with multiple frequency, younger brain, and personalized protocol. 26 ASD, moderate to severe, age 2 to 12, perform NTMS 2 sessions per week. Data was recorded before and every 5 sessions. We use an ATEC score, Autism Treatment Evaluation Checklist, to measure the result, divided into 4 domains: speech, language, communication, social ability, sensory cognitive awareness, healthy physical behavior. Lower score, lower problems. Less is better. Classify into mild, moderate, and severe degrees. Practical access by parents, translated into 25 languages, and these are my results. 26 autism children, average age is 5 years to month, average baseline score is 94, severe degree. Total score reduced 45% from 94 to 52. All domains improved statistically and clinically significant, p-value less than 0.001 in 3 months. The red color is the autism in US without NTMS. Matrian score is not a direct statistic comparison, but we can see the difference. This is the fastest intervention in the history of autistic treatment. How fast is it? The US ATEC norms chart match age and severity. The score improved year by year. At the natural course and at the age 12, the score is 40. Compared to Thai autism with NTMS, the score improved to 52 in 3 months, equal to the US at age 8 in 6 months. So, 3 months versus 40 months. Approximately 1,333% faster. Result speaks louder than words. An 8-year-old boy who has severe autism, nonverbal. Before NTMS, he was blunt and hyper-responsive to stimuli. After NTMS 2 months, he was able to clean his teeth and do housework. Normally, it took years to train this skill. A 7-year-old boy, very severe nonverbal autism, before NTMS. He was hyper-responsive to many noises, need to cover his ears. After NTMS, he can play the drums and sing a song. These are the sample of fast responder. This group improved average 78%, the moderate responder 40%, and the slow responder 13%. These are observed factors: younger age, hyper-responsive to stimuli, training more than 20 hours per week, and understanding family. Surprisingly, the baseline severity is not associated with the response. The blue line, the fast responder, baseline severity is quite high. Noted, some slow responder, MRI show brain atrophy, corpus callosum genesis, or enlarged ventricles. No serious adverse effect after 3 years follow-up. Why does the NTMS work so fast? Because we focus on the true pathology, from genetics to connectomics. TMS at the cortex can benefit to the deep descending volutes through long-range connectivity while mature. If stimulated on frontal nodes, it can benefit to occipital nodes too. Most of previous studies use a figure of 8 coil, a precise but small target. And if you change the orientation 90 degrees, the result change at least 90%. So my colleagues and I use a parabolic coil, larger target, any orientation. The TMS itself increases cerebral blood flow, stimulates neural stem cells and clear cells. We also use multidisciplinary team, physical, occupational, speech, and music therapies. We found that NTMS boosts up every treatment faster than usual. How much we can save the cost effectiveness. Performing NTMS 3 months has shown the progress to 40 months. The cost of living is about 40,000 euro in Thailand. If in Europe, multiplied by 5, we could help the family or government saving 200,000 euro. The most successful case we have in more than 10 years. So 600,000 euro saves. Not include the cost of parent insomnia, depression, medication, and suffer. At first, I planned to do a few case reports, but after 3 years, we have 155 autistic families. Families of severe autism came to me with sadness and tears through their eyes. After the NTMS, hope and bright future in their minds, bringing a smile to family, moving a better society. I'm here today not to convince you all to believe me, but to prove me with your double-blind randomized sham-controlled trial. We are happy to help. Never give up. I'm Dr. Somrot and the network TMS.